Today I want to talk about, it's an easy topic. Complicated, comes with a lot of fear, the word cancer, terminal diseases like diabetes, autoimmune conditions. A lot of people keep messaging me every day saying, Luke, how can lifestyle help? How can lifestyle medicine, which is my subject, help with this? What I want to explain to you today is based on the thousands of patients we've treated, based on simple science, evidence, common sense, knowledge, and wisdom. What we need to learn today is not more of the superfoods, more of complication. We need to understand how we need to reframe and view health and disease in our mind, whether it's a pimple on your face or whether it's cancer. Too many of our minds are filled with fear, perceptions, stories of other people's outcomes with disease, stories of other people's suffering. Everything starts in the mind. Everything starts in your mind. In fact, your mind is one of your most powerful drugs when it comes to healing and prevention. Lifestyle medicine is not alternative medicine. It doesn't ask you to choose between treatment or nature. It integrates everything together. It respects the system of medication. So if you need to go through chemo, you go through chemo. If you go through radiation, you go through radiation. You need to be on your diabetic medication, you take your medication. Because it understands that medication can treat a symptom, which if left untreated, can be fatal. At the same time, we've understood medicine wrong. It's not your fault. People have preached that medicine sometimes is forever, that you got to take your thyroid medication. Once you have type 2 diabetes, you can never get off medication. That's false information. There are certain chronic conditions where you will need medication for a lifetime, but there are many, many conditions where, as you start to change your lifestyle, as you start to address the root cause of what made you sick, your own doctors will be happy to reduce your medication over time. When we look at a disease like cancer, the first understanding is about the disease. We can categorize it as a breast, a prostate, a lymphoma, a non-Hodgkin's lymphoma, an adenocarcinoma, a small cell, large cell. All of that are medical terms for the right reasons to select the right treatment for you. But in simple language, what you have is a breakdown in your immune system. You cannot have cancer in a body where the immune system is working effectively. Number two, you have an imbalance at a cellular level. Then comes all the complicated words and the terms and the medications and everything else. So first, we give too much power to the name of the disease. Diabetes, Alzheimer's, autoimmune. Of course, it's good to know what you have. But now take away the power that you give the name of the condition and go down straight to the root cause, so that once our minds are clear, you see, when we have too much of fear, it limits us from action. When we have a lack of faith, we only focus on limitations. What we need to understand that, okay, this is the disease. Now, in my mind, what is it? It's an imbalance. What is diabetes? It's an imbalance in the body. It's a hormonal imbalance. What is breast cancer? ER positive, a hormonal imbalance. What is a blood cancer? A blood cancer is an imbalance again. What we need to then understand is, what are the action points that we have to treat an imbalance, rather than limit our mindset and our energy giving power to the name of the disease. It's established. This is your disease. This is what it's called. That's all you need to know about it. These are the treatments my doctor's giving you. Now you got to go beyond the symptom. You see, a breakdown in medical science today is that we have treated one part of the body separately from the rest of the body. Today we understand, medical science understands, that everything is interconnected. The mind, the body, the mind, the gut. You have a problem with breast cancer, you have a problem with prostate cancer, you have diabetes, you have an autoimmune. It's not just the symptom that matters anymore. While the symptom has to be treated, you have to look at the body as a whole. You have to look inside of the mind. What is wrong inside of the mind that is having an impact on the physical self? Many of you watching this today will now start to understand how limited we have been in our approach towards disease. While you put all your trust and your faith in your doctor, please do that. There's nothing wrong with that. But it's not the complete cycle of recovery and healing. It is only the symptom. You want to always find out why you got sick in the first place. Because when you know that, you can treat and address the root cause of it. One of the biggest issues today is you're treating cancer and you're having reoccurrences. You're having spreads of the cancer. What does this tell us? While the treatment worked for a couple of months, what do you think is going to work for the long term? When you address the root cause and you also start to make changes in the whole of your body and mind, you start looking at your immune system. You start looking at managing inflammation. You start looking at natural detoxification. Why isn't my liver unable to clean my system? Why isn't my kidney working the right way? Why isn't my heart able to pump blood at the right pressure? So you see things like high blood pressure, diabetes, these are just symptoms. Your body's trying to tell you you're already sick. You don't get cancer and then say, I'm sick. It's a sick body that gets cancer. It's a sick body that gets diabetes. It's a body out of balance first that gets these conditions. So we need to understand this so that in our action plan, too many of us have just allowed medicine to treat us alone. We've not looked at changing the way we eat, sleep, think, move. We've not looked at our surrounding environment. We've not looked at the environment within us that has such an important role with your healing, recovery, and your prevention. And that's why you can statistically look at chronic sickness. You got treated for one symptom. After a while, you have side effects. Now you're being treated for the second and the third. The biggest miss is while you may get the best medication in the world or the best chemotherapy or the best radiation, are you looking at managing the collateral side effects and damage of these treatments? These treatments, in its honest attempt to kill your cancer, suppress your diabetes, bring down your blood pressure, is also creating havoc and chaos in other parts of your body. So if you do not have a protocol that is looking at the side effects of your treatment, for example, every medication has a side effect. And this is what I encourage people to ask their doctors. What is chemo doing to my body? Oh, it's killing your cancer. What else? It's depleting every class A protein, vitamins, minerals. It's creating inflammation. It's reducing your immune system. You don't have to be scared about that, but you got to put in protocols to negate the side effects to the best of your ability. What's the point of killing cancer and killing your immune system at the same time? What's the point of killing cancer and creating widespread inflammation in your body? And the beauty is, even these tough treatments can be managed when you make lifestyle changes with your nutrition, with your exercise, with your sleep, with your emotional wellness, with your environment. All of this has to work together. If we are only treating the disease symptomatically, you have a short-term, non-sustainable recovery. And look around. There are two distinct categories of people. People who only treat with medication and people who treat with medication and change their lifestyles. Category 2 has the best results. Obviously, because you're addressing the root cause of the problem. I'll give you a simple example. You have a constant headache. You're prescribed a paracetamol, a Crocin, a Tylenol. You keep taking it. After a while, you have a kidney problem. You have a liver problem. But if we addressed, why do I keep getting the headache? Could be several reasons. Deficiency, dehydration, sleep deprivation, maybe a medical problem. And I addressed all of that. What would I be doing? I would be stopping that medication, preventing eventual kidney damage, and solving a problem. Harnessing the own healing powers of my own body. Medicine is great for the symptom. It's a crutch to help you. But it is our personal responsibility to look beyond the symptom and treat it. Look around at our world. We have the most advanced treatments, but look at the statistics of recovery and disease. Short term. More chronic sickness. Now let's break it down. Does it have to be extreme? Absolutely not. Some people are, but Luke, I can't be keto diet. Who's asking you to be keto? Some people jump into keto. They can do it. Great, it works for them. Does this mean everyone who's not doing keto will succumb to cancer and other diseases? No, they're also healing in different ways. Everybody is different. We cannot slap a Band-Aid approach on every treatment. Some of my patients do beautifully on a carnivore diet. Some of them do beautifully on a ketogenic diet. Some of them do beautifully on vegetarian. Some of them do beautifully on vegan with the right supplementation. Everyone is different, but more important than the food, more important than the medication is your movement, your sleep, and your emotional health. I can tell you right now, I've had patients with money to have the best treatments, personal chefs during their treatments, but they're so stressed out. Their stress levels are so high, nothing ever works. And I've had people less privileged, the poorest of the poor, from the remotest villages in India, no money to even buy almonds or pumpkin seeds, the most simplest, basic food, but happy people, absolutely grateful people, the will and the purpose to want to live, to feed their families, look after their children, and they have beautiful recoveries also. So what is right? What is right? Is it the name of the diet, the extremeness of the diet, the longer list of supplements and nutraceuticals and mushrooms and CoQ10s and methylene blue and NADs? Absolutely not. It is the fundamentals of the human body that first need to be put in place. The way I eat for my disease. If I have cancer, is my nutrition for my cancer? Is it anti-angiogenic in nature? Will it look at my DNA? Will it look at my stem cell regeneration? Will it look at my immune system? Will it look at an anti-inflammatory response? Will it look at replenishing the vitamins and minerals that the treatment is depleting from my body? Sorry about that. That's the disadvantage of living in a polluted area. You always have this thick mucus, which is part of your immune system. It's always just thicker, trying to trap in all the pollutants, the dust, and everything else. Anyway, coming back to that. So these are questions you look at your nutrition. This is what you need. It's not about cut out sugar completely, go extreme. No, it's about you had an imbalance. How do I bring balance back to every one of my trillion cells? When it comes to exercise, forget about what people think you need. What does your body need when you're going through a cancer, a disease, or a treatment? It needs blood circulation, so it needs movement. It needs stamina. It needs strength. It needs endurance. It needs exercises to make sure we're not wasting muscle. So now you design your exercise program based on your energy levels and on what your body and your disease needs, not what on Instagram's telling you. Science has taken people and put human beings into a box, and that's where we've gone wrong. Same treatment for everyone. We're such different people. That's why some chemos put certain patients in remission for the same stage of cancer, and some don't. Because we're bio-individuals. We need to understand this. We need to look at our sleep. Because no matter what anyone tells you, what is non-debatable based on common sense, science, nutritional science, and everything, all repair, regeneration, rejuvenation of the immune system, the lowering of inflammation, natural detoxification, only hormonal balance, only happens in a state of deep sleep. Making sleep one of your most powerful drugs. Who talks about these things? You're just getting chemo and radiation. No one's telling you to do what you need to really heal beyond the symptom. Then we have our emotional wellness. People have fear. Of course, anyone would have fear. How are we addressing it? How are we readdressing our connection with ourselves, our spirit? How are we using spirituality or religion, if we follow it, to give us hope, strength, acceptance, letting go, surrender? These are powerful medicines that allows your mind to be stronger. The stronger your mind, the stronger your body. Too many people have given power to the verdict, the prognosis of the doctor, the disease, and the medication. All the energy, all of that has gone into the prognosis. The prognosis doesn't define how you will come out of your disease. Your actions will. Your doctors have given you a prognosis based on science, staging, how much medication is available. That's it. It's a piece of paper. Your outcome is dependent on your actions. If you choose only to take medication, your prognosis will mostly be right that your doctors have given you. If you choose to take your medicine, go beyond the symptom, and correct everything that give your body what it needs. Everything I'm telling you is not what I think you need. It's what the human body needs. Period. Who am I to preach what your body needs? But I can teach you what the human body needs when you're going through cancer, when you're going through diabetes, Alzheimer's, autoimmune, whatever it is. Because there's a drug with certain actions and reactions and depletions. All we're doing is fitting that back into you. I've created a ton of videos on YouTube. We have had people with different stages of cancer use these free videos to aid them in their journey. And we've covered not just cancer, we've covered diabetes, Alzheimer's. It's all there. Use it. Some people come to us because they want a hand-holding. The choice is yours. The information is there. All I'm trying to tell you in today's video is the world is going wrong. Have you ever wondered why some doctors tell you, hey, listen, I can give you this treatment, but change your lifestyle. I want you to eat better. I want you to sleep. And some don't. Why? Shouldn't all doctors be telling you that, hey, this medicine can only help you with your symptom, but you got to start living healthier. Look at your stress levels. Look at your sleep. Why is there a breakdown in the uniformity of advice being given? The point is, we need to take that personal responsibility and understand that there are certain actions that we will have to own. Because at the end of the day, not many people care. And sadly, a lot of people don't have the time to care. Have you ever wondered why these things are not taught in school? Have you ever wondered why you never see an advertisement? You see advertisements of medicines and Alzheimer drugs and chemo drugs and everything else. You never see anything natural. You never see any messages of inspiration, inspiring people to change their lifestyles, because there's no money to be made over there. You need to understand that. All the money is in being chronically sick. There is no money to be made if you're healthy or if you're dead. And this is the bitter, ugly truth of society. And we need to stop waiting for that to change. It's never going to change. But what we can do is we can change the way we think about this. We can reimagine disease. We can reimagine our lifestyles and understand every single condition requires a lifestyle approach. You have high blood pressure, please take your medicines, but change your lifestyle. You have diabetes, please take your medicine, but change your lifestyle. You're obese, please take whatever meds you put on, but change your lifestyle. You can look at Ozempic and Mounjaro has become a shortcut gateway drug for people. We have a lot of those patients coming to us with the worst side effects. The drug is a great drug. It was made for a population of people who were heavily obese. I have patients at 140 kilos, 150. Ozempic, Mounjaro, below 100, every single symptom disappeared. It's great for them, not for the people who have 5 kilos to lose, 8 kilos, and now they've lost it and they have a bigger problem. They've not trained behavior around food. They've not learned discipline and consistency. And after a while, your doctor says, hey, I can't keep giving you this drug. What do they have? Frustration, desperation. They've not learned to train muscle. Their guts are messed up. There are no shortcuts in life. You got to change your lifestyle for everything. So when it comes to cancer or disease, I want you to think of a child. You empower a child with life skills to make them strong in the world that they're going to be put out in. When you have a disease in your body, that's what you got to do. You got to prepare your body to fight or embrace or overcome that disease. The medical treatment alone is not doing that. The medical treatment is just carpet bombing your symptom over and over again. That's why you have chemical side effects. But if you can take the carpet bombing of your symptom and you make the lifestyle changes, you learn how to manage side effects. Even your side effects will reduce and the efficacy of the treatment will also improve. Have you ever wondered the impact of a chemo, a steroid, a diabetic drug, a heart medication? Have you ever wondered the impact on a body that has been healthy? You think the outcome is going to be different from the impact of that medicine on a body that has been unhealthy? Absolutely. The healthier you are, because we don't know who's going to get cancer today. We don't know who's going to get COPD, ILD, or any of the conditions. We don't know. We can only do our best. The fittest of the fittest can get a deadly disease. But I can promise you one thing. The healthier you are, the better your outcome if you ever get a disease and you have to come out of it. So we have to train our minds and our bodies every day, with disease or without disease. The impact will always be different. Imagine a patient who goes into a disease with fear and rejection. I hate this drug. I don't want to be it. They've rejected it at a mind level. There is going to be a distinct way the drug works at a physical level. But someone who says, okay, I got the disease. This is the medication I got to take. I'm accepting of it. These are the side effects. I'll treat it. These are my action points. But you're in a state of receiving the treatment without any resistance. That treatment is going to work very, very differently on that body compared to someone who's rejected it. So we need to look at disease beyond the symptom. I'm here to tell you I have nothing to sell you. I don't have a multivitamin to sell you. I don't have anything to sell you. All I have to tell you is that look at yourself today and understand with simple common sense that your medicine cannot heal you alone. It can give you temporary relief, temporary recovery. But if the root cause is an address, it's going to come back over and over again, over and over again. And that is the importance of lifestyle medicine. It's not complicated. You look at your nutrition, your movement, your sleep, your emotional wellness, your external environment, your internal within you. Everything is like pieces of puzzle together. Now, when you put these pieces of the puzzle together, your chemo, your radiation, your steroids, all of that starts to work better. And you avoid the collateral damage that it can do, or you reduce it to the most minimum because you're taking the right actions. Have a great Sunday, everyone, and peace be with all of you.